So now we have indicated yes on the screening, and now we need a more in-depth assessment. But what does that mean? A comprehensive assessment is the process where more information is gathered to determine the level of care needed, as well as the strengths and needs of the entire family. Assessments are typically conducted by trained clinicians and can take over an hour to complete. We have seen many jurisdictions have a centralized assessment center or have partnerships with treatment providers that are able to provide timely access to assessments. The important thing is that the assessment needs to be timely. Again, we have no time to lose. Handing a parent a list of treatment centers and telling them to try to get an assessment is not active efforts. Having assessment centers that only take the first 5 people that show up every Wednesday is not effective efforts. Making a parent wait for weeks to get an assessment is not active efforts and will result in a lower engagement rate and increased time to reunification and permanency. Does the Family Drug Court have formal eligibility criteria that incorporate severity of substance use disorders? Does the Family Drug Court even know what the parental substance use disorder severity is and respond accordingly? Do you know which ones of your clients have a severe substance use disorder versus a moderate one? And do you respond to their needs in the same way? Does the assessment agency even share this information with you at all? These are all important questions to ask yourself when you are developing comprehensive assessment protocols. Understanding what clinical assessment is used, and importantly, is the assessment used structured and consistent with the DSM-5 criteria? Do not assume that this is happening. Research what assessment instruments agencies are using when you send your parents there. There are typically 3 different things that families are being assessed for when they come into contact with child welfare. The safety needs of the family that could pose immediate harm to the child, the level of risk that maltreatment will occur in the future, and the level of treatment needed and other service priorities. The question is, how can these 3 assessment pieces be integrated into a more comprehensive assessment, painting a clearer picture of the entire strengths and needs of the family? And if they cannot be integrated, how can the outcomes of each one of these assessments be shared through formal information sharing agreements so that all members of the collaborative have the same information? Here is an example